Hello and welcome to Common Talk about the Commonwealth. I'm State Senator Jim Welch, and welcome to the show. This is our first show that we're filming here in West Springfield at the West Springfield High School at the West Springfield Innovation Center. It's great to be here. It's a beautiful studio, and I want to thank everybody who's done such a great job to make this television show a reality and make this studio work as well as it does. Today we're very fortunate to have West Springfield's Lieutenant Rich Craven, who's here to talk to us a little bit about one of the main issues that's going on here in the Commonwealth and really across the country as well, and that's really the opioid crisis. And it's a very obviously serious issue, an issue that we're dealing with here in West Springfield and across the state, and we're very fortunate to have you on the show with us today to talk about your experiences and what West Springfield's doing to fight this crisis. So always like to start the show off with our guests to give you a little time to talk about your background, who you are, kind of how you got to where you are, and how you got to the position that you're in right now.
Sure. First of all, thanks for having me. I am a lieutenant for the fire department, been on for 13 years, and I've been a paramedic for 17 years, so I have field experience directly with opioid-related issues, and just happy to be a part of this.
Well, thank you very much, and again, thank you for all the work that you do and your teammates in the West Springfield Fire Department and really all over. I know that you're saving lives on a almost daily basis, every day, every week. So we certainly appreciate all the hard work that you've put into it. So to talk a little bit about the situation or the crisis that has been going on here for the past 5 years or so with the opioid epidemic. Can you just give some general statements or statistics about Massachusetts and maybe West Springfield and Western Mass about the dealings and the issues that have been happening here?
You call it an epidemic, a problem. It's been a problem for years. It's definitely been heightened over the past several years, because of media relations and even the potency of the narcotics that are out there and the availability of them. I can tell you it's been a problem just because we've had at least one in town. I can tell you 2016, the fire department alone has administered Narcan, which is the reversal agent, which we'll talk about, over 63 times to suspected opioid-related emergencies. The drug itself is given for other reasons, but primarily it's for opioid-related illness that we end up encountering. Statewide, it's an issue as well. The real statistics statewide, I'm not too sure of, but I can tell you that it's a problem. It's something that needs to be addressed on the national level as it is, and West Springfield's doing our part on it as well.
Right, and I think one thing to make clear, and I'm sure you can add to this as well, is it's not just a West Springfield issue, it's not just a Western Mass issue, it's not just a Massachusetts issue. All across the country, this is an issue for all communities, and West Springfield's not alone. But I think West Springfield, maybe you can talk a little bit about the CARE Coalition and some of the community type groups that are working to bring people together to help deal with the issue.
This is something that affects everyone. For us specifically, anywhere from 18 to 64 years old has been our patient range of where we had to administer Narcan. The West Springfield CARE Coalition, it's an organization made up of public officials, police, fire, EMS, members of the school department, family members from the community, and students. And the focus really is to try and raise awareness and talk about preventative measures and where people can go to have support for this, both for those who use and abuse narcotics or prescription medications, and for the family members as well.
And I think there's a couple different angles that we'll talk about today. One is maybe from the preventative side of things, which is obviously very important, and then maybe from the episodic treatment standpoint with the Narcan. And I think later on in the show we'll talk about how to administer, and if a situation were to happen, you'll give us the instructions on how someone can recognize it and how to actually administer the drug Narcan. But can you maybe talk about some of the things that West Springfield is doing in terms of prevention?
Well, the West Springfield Care Coalition, you can follow them on Twitter, 1089 Cares. And what they do basically is, pretty much every school event, you'll see someone standing there from the Care Coalition with flyers, materials to talk about, the opioid problems and where to go for resources. There's a lot of host events, sponsored events at local restaurants where we're just trying to get the word out. It's one of those things that, if you are directly involved, you kind of want to hide it. You don't want to talk about it. Like there's a stigma hanging over it, but we want you to talk about it. Right. You need to be able to reach out and know where to reach out and how to talk to somebody about that. And the Care Coalition is out in full force to try and do that. There's some fundraising events coming up May 10th at the Public Library, where everyone is invited. And June 4th, the firehouse down at the Station 4 down at the Eastern States is hosting a pancake breakfast as well. So you'll be able to meet and greet members of the Care Coalition, members of the fire department.
Great. And I think we can probably get that information on the screen so our friends at home that are watching can see the information about those upcoming events. And you mentioned something, stigma attached to this. And, oftentimes I think family members and people that are suffering aren't necessarily, whether encouraged or feel comfortable about talking about the issue that's happening or that they're dealing with a family member. But that's really an important step, right, is to get people comfortable and feel as though that they have somewhere to go and other people in the community that they can talk to help try and get their loved one some help. Yeah,
it's important to not go at it alone. The resources are out there. I know the Hampden County District Attorney's Office has an addiction task force that they put together. On their website, it has resources for supportive programs for both users and family members, children, grandparents, other caretakers. But it's just getting the word out there and being comfortable, being able to talk about it is one big step.
And I think that's a great point, a great statement. Don't go at it alone. And I think part of the reason why we're doing this television show on this subject is because we understand the importance of getting the message out, that there is help out there, that there are people that in the community that are there and willing to help every family, because the reality is this can affect any family at any time. We all know that, and we want to make sure that the message is out there that West Springfield and the community via the Care Coalition or public safety officials or public health officials, that there are resources here in West Springfield to help families that are struggling with this. So now maybe just go into a little bit of the technical aspect of things. And we hear the term overdose, but I'm not sure people actually understand what that means. But if you're a family member or if you're somebody, what are the signs that you can look for, or what is a telltale sign of an overdose?
Well, to recognize there's an issue, it's really case dependent. You want to be out there, you want to be able to talk to your kids, be involved, know what's going on, notice any changes in behavior. As far as the actual overdose itself, there are specific symptoms that you can recognize. For instance, a lack of breathing. Normally, if we're sitting here, you're breathing normally, breathing in, breathing out. If someone has overdosed, their breathing is very, very slow. And it gets to a point where the breathing stops, and that's where things start to take a turn for the worse. Changing in mental status. If someone's not answering questions appropriately, when you feel like they should be talking to you and able to have a conversation, but they keep falling asleep or keep nodding their head. And again, that shallow breathing could be an indication that they may have taken an opioid of some sort. In addition, looking at the pupils, looking at the eyeballs. Normally, the center part of the eye is average size. With an opioid overdose, it becomes pinpoint, becomes very, very small. It doesn't have any changes or reactions when light hits it. These are things that we look for in the field as first responders and EMS personnel to kind of give us an idea on if it's an overdose or not.
And I think we'll go into a little bit later about Narcan and the importance of it and what it's used for. But I think you had mentioned opioids. They come in all different forms, correct? And can you maybe talk to or explain to the people at home? Most people think of an opioid as heroin, but it starts and it comes in many other forms as well.
Yeah, I mean, over-the-counter medications, there are some that are prescribed by physicians. You know, anything from Percocet, OxyContins. You know, if anybody has had any outpatient surgeries, they're discharged home with you know, a large bottle of prescription medications. One of the preventative measures and safeguards that parents can do is keep control of them. Don't ever let anyone have access to them to take more than the prescribed dosage of it. Keep them locked, keep them secured. A lot of times folks, you know, opioid addicted people will go to family members, you know, perhaps the elderly that may not have a heavy control on their medications and take and steal from there. They just become dependent upon it and do whatever they can to try and find the next one.
So we have about 1 minute left in this first segment, and you know, what are some of the signs? We talked about signs of an overdose, but if a family member, you know, maybe suspects or has an inkling that maybe, you know, a loved one is entering into opioid addiction or even just beginning with it, what are some steps that a family member could take to try and either offset that or you know, get their loved one some help immediately?
I mean, speak up is the first thing. You know, get involved, be involved with you know, family members, and you can reach out. I know our police department has resources. We can direct you through the fire department as well as far as where to go from there. The Hampden County Addiction Task Force Treatment Resource, they have brochures, and again, the website we'll put up there as well. The Care Coalition sponsored a Hidden in Plain Sight at the Holyoke Mall a little while back, and it was basically looking at the room and contents of, you know, an average teenager and looking for those small little things that you might not pick up on a daily basis that may lead them down the road of opioid addiction. And it's really just, you know, trying to talk about it.
Being aware and having that conversation. So, well, that's great, and that's the end of our first segment here. I think we're going to take a break now and have some public service announcements, and we'll see you on the other side.
Listen, I realize that I'm not perfect, but it all really started to change because you judge me for having a problem. No one is going to know that I need help. I need help. I know that no one is going to judge me for having a problem. I realize that I'm not perfect, but it all really started to change because you listen.
This year, patriotism shouldn't just be about pride of country. It should be about love. Remember that to love America is to love all Americans, because love has no labels.
Hi, and welcome back to Common Talk about the Commonwealth. I'm State Senator Jim Welch. Thanks for joining us today. And again, we're very fortunate to have Lieutenant Rich Craven with us today from the West Springfield Fire Department. And Lieutenant, you've been talking to us about the issue of opioids and the opioid crisis here in Massachusetts, Western Massachusetts, West Springfield, and really across the country, and some of the statistics, some of the signs, some of the preventative measures that are, you know, taking place not only here in West Springfield but across the state. And before the break, we talked a little bit about or mentioned Narcan. And I think people maybe at home have heard of the term Narcan or heard of the product Narcan. But can you talk a little bit about what it is and what it's used for?
Yeah, Narcan is an opioid reversal. So if someone takes an opioid, you know, prescription pain medication or heroin or something along those lines, they basically, the opioid sits in a cell in the receptor sites. And what happens is the Narcan, once this gets delivered on board to the patient, the Narcan kind of bumps that opioid out of the way. So they don't feel the effects of the opioid, they're feeling the effects of the Narcan. The thing with the Narcan, though, is it doesn't last as long as an opioid does. So if Narcan is given, the person or the patient, as we call it, needs to go to the hospital. Narcan is readily available to those who ask for it, basically. I know there's certain pharmacies in the area that do administer it. I would recommend contacting the West Springfield Health Department as well to find out some more resources on where someone who has a family member addicted to opioids, where they could get it. A lot of times, especially now within the past couple months, when our fire department first arrives on scene, Narcan has already been given, which is great. The fact that it's there, that it's out there in the community is a definite plus. It is, you know, reversing some of the effects of the opioid overdose. But in terms, Narcan is a Band-Aid. It's covering up the underlying problem. You know, these people, patients need, you know, further resources, in-hospital treatments, rehabilitation, therapy, to go from there. But having Narcan readily available is a lot better.
Right, and as the people at home can see, we have a simulation mannequin that you brought from the West Springfield Fire Department that paramedics and you all train on, you know, when it comes to the delivery of Narcan. And, you know, you're going to walk us through some steps of how it can be administered and you know, what the proper steps are should anyone find themselves in a situation where they do have to help someone and administer the Narcan.
Yep, this is little Jerry. We do train on this, and it's just a child simulation mannequin. It's not meant to mean that children overdose on opioids. It's just strictly for carrying purposes. This was easier to get in here. The Narcan that we carry in the pre-hospital environment comes in a little orange-pink package like this. I can tell you the West Springfield Police Department has also done a very great job recently by putting Narcan in the police cruisers and being the first response vehicles, sometimes even before the fire engines, to administer Narcan to patients, so that's been a huge help to us. When the Narcan comes out of the package, it comes in two different forms. It's safe and effective. It's a needleless system, so it's meant to be used by anybody without the risk of poking yourself as well. The device becomes assembled when you screw the two together, and the yellow tip comes off, and this is the component that really makes a difference. This is the nasal atomizer. This is what takes the medication and turns it into a mist form. And just to give you an idea, when this is administered and pushed, it turns it into a smaller mist. So when this is absorbed in through the nose, it gets into the bloodstream a whole lot faster than if you were to take a pill or do something orally. Once it's administered, our EMTs and paramedics and first responders are all trained to administer the medication intranasally through the nose here. What we do is we'd have our patient who's laying on the ground. If you have somebody and they are laying on the ground, before we get there, if you could lay them on their side, that way in the event that there's any type of vomit or anything in the airway, it would remain clear. We'd take the Narcan and place the atomizer into one nostril, as you see here, administer half of the dose, and it's a fast push, and then we do it in the other nostril too. That way more surface area is available for the medication to be administered. Another thing that we do in the pre-hospital environment is we assist the ventilation. So we'll take a bag valve mask such as this, place the mask over the person's face, and then squeeze. And it's almost like we're simulating a respiration. We're trying to get these patients to breathe, and we're trying to move oxygen throughout the body. If you don't have one of these readily available, that's completely fine. Just getting the Narcan on board is going to be effective. The biggest thing that you can do once you've recognized this and administered the Narcan is call 911. You know, letting us know and letting, you know, police department respond as well. It's the first steps in, you know, going in the right direction. Some information that we're going to want from you from 911 is maybe a callback number just in case it becomes disconnected. We want to know the location that you're calling from, and be honest with us. Let us know if it was an opioid overdose, just because it's going to help us get this medication on board faster.
So from what you've demonstrated here, it's basically a nasal mist spray that you spray up the patient or the person's nose. It's not a needle going into their body.
No. It's fast and easy. Okay. Narcan has been around for a while. I've been like I said, a paramedic 17 years, and we've had Narcan. We used to have to inject it intramuscularly or try to get it on board through a vein. The intranasal administration of it has made things a whole lot easier. It's allowed us to get the medication on board faster, and it works. It's proven effective for us in town.
Right. And as you mentioned, Narcan is a Band-Aid, right? It treats an overdose. It doesn't cure anybody of any struggles that they're having. But who should maybe think about, if they don't already, having Narcan, you know, available to them?
Anyone that has a suspicion, if someone that they know is using or abusing prescription narcotics or opioids in any form, you know, like I said, contact our health department, and they'll be able to point you in the direct resources for West Springfield and how you can
Right.
obtain that.
Yeah, and we'll put the information for the West Springfield Health Department up on the screen if people do want to inquire about how to get Narcan, to have it at their availability, just in case. But again, it's as we talked about it, it's a treatment for an overdose situation. It's not preventative. It's not a cure. It's more of an episodic, as you said, treatment. But it's important to have for anybody who feels as though that they have a loved one or a family member who is suspected of using opioids.
Yeah, absolutely. It fixes the now, which is what you want. If the opioid overdose continues to progress, breathing stops, and then they go into cardiac arrest, and it's very, very difficult to regain pulses from that. Having Narcan readily available is great. It absolutely is great, but it needs to be taken further than that.
Right. And I think you mentioned it, but if someone does administer Narcan to a friend or a loved one, it's also important to call 911.
Yeah, you have to call us. It's nothing where we want to help. That's why we're here. That's why most of us are in this profession, is because we want to help others, no matter the cause. But get us there early, because as I mentioned before, depending upon the narcotic or the amounts of the opioids that were taken, Narcan's only going to last for a little bit. So you'll administer the Narcan, everyone wakes up feeling happy and fine, which they don't. But the symptoms of the opioid overdose may return, and it may become unrecognized. So always give us a call.
And in terms of administering it, say if someone doesn't have Narcan readily available, but they do recognize somebody in distress and they call 911, is there a time, an average time where, Narcan has to be administered for it to have the most positive outcome?
No, we want to get it on board as early as possible, and strictly to fix that respiratory depression. That's kind of where things start to cascade and turn bad. So earlier the better. If you do call 911 and you are transferred to the fire department, all of our fire department personnel are emergency medical dispatch trained, so we have specific guide cards that we can follow to help walk you through the steps. We can, if you forget how to assemble a Narcan device, we can walk you through the steps on how to do that over the phone before the first responders get there.
Right. And again, Narcan, if anyone is watching at home and they feel as though they're in a situation or a position where Narcan might be something that they might want to have readily available, contact the health department, or really any department in West Springfield, whether it's fire, police, and that agency or that department can help that person find where they can. And as you mentioned too, there's pharmacies in the local area that you can also obtain Narcan from. So we have about a minute and a half left of the show, and again, I want to thank you for coming on. This is such a really important issue and topic that we need to continue to get information out about to the community. With 30 seconds or so, what would you say to community members that are watching at home about the entire opioid issue and crisis that's going on in West Springfield and Narcan, and what's the most important thing people should get out of this show?
It is recognize when there's a problem or a potential problem, trying to stop opioid abuse before it becomes a larger issue, and just be involved with your family members, be involved with your children, talk to your kids, know where they're going, know what they're doing, follow up on it. Not trying to be overbearing, as a father myself, but you have to be able to talk about this. It's not, as you mentioned before, that stigma hanging over your head. It affects everyone. And I guarantee that someone out there that has a problem, and being able to locate the resources on where to go and how to get the help is one of the first steps on what we're doing here.
Perfectly said, and I think earlier in the segment you said it's important for people to know that they're not alone in this struggle. If they are dealing with this issue with a loved one, there are people and resources out there to help, and the first part is to open up and to talk about it and seek the resources that are available. So Lieutenant Craven, I want to thank you for coming on our show today. Obviously very helpful, very difficult, tough issue to talk about, but an issue we need to continue to get information about to the community. I want to thank you for coming on, sharing your wisdom with us, and I want to thank our friends watching at home for the first episode of Common Talk about the Commonwealth happening here in West Springfield at the new studio at the high school. I want to thank our producers and all the people whose names will come up afterwards that made this show happen. Thank you very much, and thanks for tuning in, and we'll see you next time.